Order. I will call Jerome Mayhew to move the motion, and I will then call the Minister to respond. And of course, there won't be an opportunity for the member in charge to wind up, as is the convention for 30-minute debates. Order. Jerome Mayhew to move the motion.
Thank you, Mr. Dowd. It's lovely to see you in the place of the chair, and I'm very grateful for a number of colleagues from East Anglia coming to support this debate, and I hope to make some interventions as well. And I'm grateful for the Minister for coming yet again to Westminster Hall, because this isn't the first time that we've had a debate on dentistry on the east of England and in East Anglia in particular. And the reason why we've had numerous debates is because we've got a very, very significant problem with the access to dentistry, in particular to NHS dentistry and dentists, but also even to private dentists in the east of England. There have been so many debates. Peter Aldous, who lost his seat at the last election, I'm sorry to say, was a doughty campaigner on this issue, and I paid tribute to him for the numerous debates that he brought forward. And then most recently, just in September, the Honourable Member for Norwich South, who's not here today, but he had a debate on this topic just 2 months ago. But time is short, Mr. Dowd, so I'm not going to focus as much as I would normally on the need, because the Minister's been here before. He knows very well as I do, how significant the need is for increased access to NHS dentistry in East Anglia. But I will just give highlights, because his own Health Secretary, the Right Honourable Member for Ilford North, has described Norfolk not only as a dental desert, but as the Sahara of dental deserts. And his Minister, the Noble Minister Baroness Merrin in the other place, just a week ago, on the 25th of November, from the dispatch box, confirmed that Norfolk and Waveney has, and I quote, the worst ratio of NHS dentists to patients in England. The last debate that I took part on in this forum, I was shocked to put forward the following statistics, that the ratio of dentists in Norfolk and Waveney per 100,000 of the population was just 39, when the national average was 52. But now I have to update the House on those figures, because the Secretary of State has recently confirmed that that figure of 39 has dropped to 36 per 100,000 of the population, whilst the national average has increased to 53. So this is an issue, Mr. Dowd, that is getting worse and not better. And the latest data, the data from this month, is even more concerning, because the British Dental Association, whilst it confirms that there are 3,194 NHS dentists in the east of England, and that's the stats that we were using previously, when you do further analysis, as they have done last month, it actually reveals that this equates to just 1,096 full-time equivalent dentists doing NHS roles. And that means that if you then run those figures through the population, we have 17 full-time equivalent NHS dentists per 100,000 members of the population in the east of England. These are truly shocking figures. And you can see it again if you want to slice and dice it another way, Mr. Dowd. If you look at the amount of money that the government spends on people's mouths in the east of England, it makes for pretty sobering reading. So the national average is £66 per mouth is spent in dental treatment by the NHS. The east of England, that figure is just £39. So what is it? Is it that our fillings and our dental work isn't any cheaper in the east of England? We're just doing less of it. And it's not because we've got less demand. We've got the greatest demand. We had over 1,000 people present in the last year to NHS A&E with significant dental problems. I believe I'm right in saying that dental concerns are the single biggest reason why primary school children present at our hospitals. I will give way to the Honourable Member.
On that point, a very critical point, Mr. Chairman, in relation to dental care. It really has to start at primary school level. I know when I was at school, that wasn't yesterday, of course, yeah, but that they always come in, they check your teeth at an early stage, and you had that the whole way through. Yeah. That process is missing today. Does he feel that's where the first stage of response needs to be?
Well, I'm grateful for the honourable member for Strangford. It's the east of England, not quite the east of Northern Ireland, but I'll take the intervention anyway. He's quite right that we learn our oral hygiene habits as children. The primary responsibility of that has always been and should always remain that of the parents. It's parental responsibility who should look after the health of your children. But we recognise, as the last administration, increasingly the role of primary schools to reinforce the role of parents. There was a second intervention. I'll quickly take that.
I'm grateful. Does the honourable member agree with me that it's an appalling situation that my constituents have had to resort to pulling out their own teeth because no NHS dentists in my constituency are accepting new patients, and we need urgent action now?
I'm shocked to hear that. I did have an example of that in my constituency reported to me during the height of the COVID lockdowns. I haven't, to be fair, had it since then. But irrespective of the sort of headline-grabbing anecdote, it is absolutely the case that we have an almost impossibility if you're a new applicant for NHS to be registered as an NHS dentist. It's almost impossible to do that. And I've got the figures to back that up, because the ONS data of November this year says that 98.4% of those who do not currently have a dentist but want to access NHS dental care in the east of England failed to do so. 98.4% are unable to register for the first time. And that is the worst result in the whole of the English regions. And yet this is a period where we underspent our NHS dental budget in the east of England by £58 million. That's not because the government doesn't want to spend that money. It's not because the money isn't available. It's simply because we don't have enough dentists to satisfy this huge need. I will give way.
I'm grateful to my honourable friend for giving way, and thank you, Mr Dowd. Would the honourable member agree with me that the absolute early priority must be to sort out emergency dentistry? Everybody must be able to contact an NHS emergency dentist for terrible toothache or dental emergencies, and this is what will stop us admitting many children to hospitals for draining of abscesses, which I have had to do as an ENT surgeon.
I'm grateful for the intervention. Yes and no would be my answer. There was a lot of money in Norfolk and Waveney put into increased access to emergency dentistry in the last 18 months, 2 years. And whilst I welcomed it, and it did help to deal with some of those acute issues, we've got a much more fundamental problem here, Mr Dow. We've got to actually fix the system rather than decide which is the least worst form of emergency care once the problem has become acute. So the big question for this debate, Mr Dowd, is why is it that the east of England is in this position? Because if we don't get the right analysis of how we've got to this place, we're going to impose the wrong solution. Some people say, well, it's because Norfolk's a rural area and it's got lots of coastline and that brings its own problems. It's remote. If you're newly qualified as a dentist, it's probably a rather unfashionable place to go and make your new career if you're not from that neck of the woods. It has a more elderly demographic. Perhaps that puts off young dentists and not where they want to go and set up their new home. And yet you can compare Norfolk with another similar county. I often use Devon because it shares so many characteristics. It's got a slightly older population. It's got a large rural coastline. It's pretty similar. It's pretty similar in size in terms of population. And yet, if you look at the number of dentists in Devon, they have 49.6 per 100,000 of population. That's a huge increase, a huge improvement over the east of England. So what, Mr Dowd, is the difference? And the answer is very obvious. They have, and have had since 2005, a dental training school at Plymouth. And that was the last one. In fact, the east of England bid for that contract and lost out to the Peninsula bid, and we can see the consequences in the teeth of Norfolk residents. So, if you want to train as a dentist in Norfolk, or other counties in East Anglia, Suffolk as well, the nearest place you can go and train is either Birmingham or London. That means that our homegrown talent has to go off somewhere else, several hours away, to train and qualify, and the usual things happen. They develop their professional relationships in that region, they meet, fall in love, settle down, put down roots in the community, and they stay, they don't come back. And the exact opposite is the case for people who are not from our region, who qualify elsewhere. What is the incentive to come and set up home in a part of the world that you don't know, that is not attractive to people in their perhaps mid-20s as they're newly qualified? And we also know that where you train, about 40% of graduates tend to stay around. We've got that data from the University of East Anglia in their medical school, because they survey each year their graduates to see where they get their first job. And 40% of them take a job locally every year. Now, this is a really important question for the Minister. Does he accept, and does his department accept that analysis? Because if not, what is his explanation for the dearth of NHS and even private dentists in East Anglia?
Will you give way?
I will give way.
I'm grateful to my constituents for giving way and congratulate him on securing this debate. I can't speak for the Minister. I certainly welcome the comments about the importance of a dental school, but is the issue in East Anglia not because of its disproportionate failure under the previous government's dental recovery plan, which it said would miss its targets, and if it did hit them would be 2.6 million dental appointments short of pre-pandemic levels? He was on the government benches in the last Parliament. Does he not understand why many people across East Anglia hold the Conservatives to account for the situation getting this bad?
Well, look, I accept the argument from the Honourable Member for North Norfolk. I don't think it's particularly helpful. We're trying to work out what the solution is now going forward. There was a huge amount of money spent by central government on NHS dentistry. The problem we had, as we can demonstrate by the £58 million underspend of the budget that was available, is there physically are not enough dentists. Now, that is not a short-term brickbat you chuck around for party political points in a Westminster Hall debate at 11 minutes past 11 on a Wednesday morning. That is actually a rather more serious issue that deserves a slightly more serious approach, in my submission. And I will take my other neighbour first.
Thank you to my neighbour for giving way. On the point of cross-party support, does he recognise the party support across all parties for a new dental school at Norwich, and would he welcome the 1.5 million announced last week by the Norwich Growth Board in support of that bid for the new dental school?
Mr Dowd, that's the kind of intervention which I do find constructive and helpful, and I'm very grateful, and she is, of course, is quite right. We disagree on many things, as I do with the Honourable Member for North Norfolk, but there are some things which bring us together, and the need for a dental training school at the University of East Anglia is one of them. I'll give way.
Thank you for giving way, and thank you, Mr Dowd. Down the road from Norwich is the University of Essex, based in Colchester, where they're already offering degrees in oral science, and so I think a collaboration between the two universities is really important. I'd be very happy to facilitate that. It's not a dentistry degree, it's an oral health degree. The university also has a community dentistry clinic already operating in Colchester, which I think could give some very interesting examples, and I'd like to invite the Minister and team to come and visit both facilities.
I'm grateful for that intervention as well, and she's absolutely right. This is not a one organisation over another. This has to be a collaborative approach. We've got plenty of dental need to go round, I'm sorry to say, in Suffolk, Essex and in Norfolk. And the more we can collaborate, and the more of a synthesis of offers that we can provide, so some being in dental health qualifications, others being in straightforward dentistry, and hygienists as well is another key part of this jigsaw that we have to put together. So, yes, I will, and then I'm going to make some progress off that.
Thank you, Mr Dowden. Thank the member for giving way. I'm all for cross-party working, but I was struck when he mentioned earlier the comments about children. And does he accept that because of the legacy over so many years of failure, that any solutions are going to be so much more difficult because we are going to have dental issues progressing as children grow older, making any solutions that much more difficult to achieve?
I thank him for his intervention. There is a difference between milk teeth and, I'm going to call them grown-up teeth, but I know that's not the technical term. So I hope you're wrong on that, but there undoubtedly will be, if you have long-term lack of access to dentistry, it builds up problems, whether it's in the teeth or the gums, both for children and for adults. And we can all talk about how we get here, and I can defend lots of the things which the previous administration did, which was very good. But did we get everything right? No, we didn't. What I'm more interested in is how we encourage the government, how we work with the government, cross-party, to help to solve this problem in the very near future. So, I hope we've got to a reasonable analysis as to why we're in this position. And if it's the case that it's because there's a lack of, very substantial because there's a lack of dental training facilities in the east of England, one of the obvious solutions, not the sole solution, but one of the obvious solutions is a School of Oral Health at the University of East Anglia. Now, the Minister knows this. He knows that the University of East Anglia, the UEA, is ready to go. He knows that there's a building under construction that substantially, there's been large funding already applied for and some of it agreed already. He knows that the UEA is making an application for registration with the General Dental Council and that will be completed within the next 6 weeks at the latest. And so that brings us to the crucial next step, which is the Office for Students. And this is where I recognise that the Minister is both important and impotent at the same time. He's important because he's the Dental Minister, he sets direction, he gives the impetus to change. But I do accept that he is in some sense impotent because the Office for Students is an arm's length body, an independent body. So I hope he takes these requests in the light of my acknowledgement of the constraints that he works under. But what would be really, really helpful for the UEA and for the residents of our area is confirmation from the Minister on the following 3 points. The first one, that there will be additional dental training places made available by the Office for Students in 2025. So this is a political decision. How much funding is the government prepared to put to the overall number of dental training places in the country in 2025? The pot that the Office for Students has to work with. So can he confirm that that will not just be the same number, but will be an increased number to take account of increased need? If that's the case, will there be a regional allocation within that global figure specifically for the east of England? Given that we know that need is not national, it has regional variations and that the east of England is the worst area of all. There is precedent for this because recently medical training places have had a regional allocation, although I accept that it hasn't happened historically with dental places. But that is very, very important and will be a huge encouragement to our residents. And thirdly, can he give some kind of indication of the timetable that he and the Office for Students is going to work on in order to process the 2025 allocations? Now, I recognise I will give way.
Thank you very much, the honourable member, for giving way, and thank you, Mr Dowd. I welcome the comments that the honourable member is making, and indeed the dentistry school at the University of East Anglia and the funding for it is a welcome step in addressing our chronic shortage of dentists in the region. But we do indeed need to make sure there are strong incentives for those dentists to stay locally, but also strong incentives for them to stay within the NHS, which means meaningful contract reform to make it economic for dentists to practice in the NHS long term. So in addition to the points he's made, would the honourable member agree with me that we need the Minister to set out the timescales for the pledge the government has made to review the dental contracts?
I'm grateful for the honourable member's intervention. He is absolutely right. The school is not the only answer, but it is part of the answer. And part of the way that they're going to encourage graduands and then graduates to be sticky, to stay locally, is that the training process which they are intending to put in place is that from year one, students are placed in local dentists. So they're providing benefits to real people right at the start of their practice, but also they're developing the professional relationships with local dental practices so that they can walk into good quality jobs locally, and that should help with the stickiness. But he's also right, it's not the full solution. We do need reform of the 2006 NHS dental contract. That's not specific to East Anglia. It doesn't explain why we're in the particular pickle in the east of England. And I recognise that that is the subject which would happily take up another debate. So I'm not going to get too distracted whilst recognising its importance. And then the other problem, which is slightly more recent in its origin, is the imposition of national insurance contributions to dental practice. The British Dental Association has outlined that the recent budget can have a devastating impact on struggling NHS practices. And I've got a local practice in Norfolk said this, and this is a quote: "The recent changes to employers' NI and raising of the living wage will lead to bankruptcy and breakdowns. We've been trying to keep our 100% NHS dental practice open under very difficult circumstances, being unable to fill our vacancy for a full-time dentist. This post has been empty since April 23, and we can no longer go on with only one dentist and pay the bills." Now listen, I recognise that's above the Minister's pay grade, but I do hope that in his advocacy, when feeding back to His Majesty's Treasury, that they are fully aware of the negative impact on dentistry as well as on GP practice and all the rest of it that the NI increases are having, and that is taken into account in future decisions.
Thank you. The question is that this House has considered dental healthcare provision in East Anglia. Minister.
Thank you very much indeed, Mr. Dowd. It's a real pleasure to serve under your chairship, and thanks very much to the Honourable Member for Broadland and Fakenham for securing this vitally important debate on dental healthcare provision in East Anglia. I'd also like to thank all of the Honourable Members from all sides of the House for their really important interventions in this debate. The debate follows on the heels of a debate led by my honourable friend, the member for Norwich South, on the 3rd of September on healthcare provisions in the east of England. Now, we know that huge swathes of the region are dental deserts. These areas are facing greater pressures from challenges in the recruitment and retention of dentists and leaving patients struggling to access the NHS dental treatments that they need. Mr. Chair, it's, I have to say, a scandal, as has already been pointed out, and Dickensian, frankly, that the #1 reason for children aged 5 to 9 being admitted to hospital in our country in 2024 is to have their rotten teeth removed. Norfolk and Waveney Integrated Care Board had 31.5 dentists per 100,000 of the population in 23-24, which is the lowest number in England. That's why I've met with colleagues from the east of England, including the honourable gentleman, to discuss the specific challenges in the region and to discuss the University of East Anglia's plans to open a dental school. Now, the UEA's proposal to begin training dental students is very welcome news. As I said to all of the colleagues that met recently, and also during oral questions last month to the honourable gentleman, the government strongly encourages the UEA to continue its progress towards establishing a dental school by submitting its bid to the General Dental Council as rapidly as possible. The Independent Office for Students is another key player in all of this, and they, of course, have statutory responsibility for allocating funded training places to dental schools. So, as the gentleman has pointed out, I cannot, as this body, the OFS, is independent from government, I can't make specific commitments around allocating additional training places for future years, because to do so would be to cut across the independence of the OFS. The OFS takes its decisions based on their own assessments, following guidance issued by government. So what I can say to the honourable gentleman is our guidance, of course, is influential, but I can't guarantee the outcome of that guidance. The guidance will be published in due course for the 2026 academic year, and provided the UEA does meet those requirements, the UEA would absolutely be considered for government-funded dental training places. Now, this would certainly help to retain local dentists in East Anglia, and as someone who represents a rural constituency, I do absolutely understand how important that is to him and to the many other members in this chamber today who are present in that part of the country. Now, we do also have to have a clear-headed diagnosis of where we are, and it is beyond doubt that NHS dentistry was left in an appalling state of disrepair by the previous government. As the Prime Minister said last week, the precious contract between the state and the British people has been broken. And he rightly said that our public services are in crisis, unable to perform basic functions and unable to provide the timely care and dignity that Britain and the British people rely on. Almost 5 years on from the beginning of the pandemic, NHS dentistry has still not recovered to pre-pandemic levels. Only 40% of adults were seen by an NHS dentist in the 24 months to June this year, down from almost 50% before the pandemic. And whilst 34 million courses of dental treatment were delivered in England in 23-24, that is down from almost 40 million courses of dental treatment 5 years ago. And as I mentioned earlier, it is disgraceful that having rotten teeth removed is the single most common cause of hospital admissions for children aged 5 to 9, causing them untold pain and suffering and affecting their ability to sleep, speak and socialise. Whilst I'm on the subject of the general state of dentistry, I'd like to thank the National Audit Office for their recent investigation into the previous government's dentistry recovery plan. Their report lays out in black and white something that was already apparent to millions of people across the length and breadth of our country. That is, the dentist recovery plan that we inherited did not go far enough. We're reflecting on every line of the NAO's report as part of our efforts to rebuild dentistry, get it back on its feet and make it fit to serve people of all ages going into the future. And we've launched the largest ever national conversation to inform our 10-year plan to reform the NHS, and our workforce will play a central role because they're key to unlocking improvements across our communities. On that subject, the Golden Hello scheme offers dentists £20,000 to work in underserved areas of the country for 3 years. The recruitment process is well underway, with posts being filled by dentists in these areas as we speak. As of the 7th of November, 64 posts had been advertised. Our manifesto pledged 700,000 more urgent dental appointments, and we're working to ensure patients can start to access these as soon as possible, and they will be targeted at areas that need them most. Strengthening the workforce is key to our ambitions, but for years dentistry has been facing chronic workforce shortages, and we have to be honest that bringing in the staff we need is going to take time. To rebuild dentistry in the long term and increase access to NHS dental care, we will reform the dental contract with a shift to focusing on prevention and the retention of NHS dentists. There are no perfect payment systems, and careful consideration needs to be given to any potential changes to the complex dental system so that we deliver a system that is better for patients and for the profession. I will give way.
Thank you very much to the Minister for reiterating the Government's commitment to reforming the dental contract. Please could he set out a timescale for that work commencing?
Well, I was just going on to say that we're continuing to meet the British Dental Association and other representatives of the dental sector to discuss how we can best deliver our shared ambition to improve access for NHS dental patients. We're working on this as a matter of urgency. I can't give a specific time frame at this time, but I can tell him that this is a top priority for the department. I've got very short.
I thank the Minister and thank you, Mr Dowd. I understand that you do inherit a big problem, but the situation is really urgent. I have one constituent, for example, who has heart problems, so his oral health is really, really important to him, and he cannot get an NHS dentist. So we do need, for constituencies like Ely and East Cambridgeshire, really urgent action on this.
I thank her for that and absolutely share the need for urgency, for focus. We have got a big mountain to climb, but we absolutely have to crack on. And I completely take the point in terms of the need for urgency. One of the areas around workforce, if I can very briefly, is ensuring that the process to register a dentist in the UK is as efficient and fast as possible, whilst retaining robust safeguards for patient protection. The Department regularly engages with the General Dental Council to understand what it's doing to improve the waiting times for the overseas registration exam. Earlier this year, the Department ran a consultation on introducing a further piece of legislation to give the GDC powers to provisionally register overseas qualified dentists. And I do think that that's something that can help to address some of the workforce challenges. So, Mr Dowd, in summary, it is an immense challenge, There are no quick fixes and no easy answers, but we will choose change, not because it's easy, because it's what we have to do. We've got to do those hard yards, and I do look forward to working with the honourable gentleman and other colleagues to deliver what needs to be delivered.
Thank you. The question is that the House has considered dental health care provision in East Anglia. As many as of that opinion say aye. Of the contrary, no. I think the ayes have it, the ayes have it. Order, order. The sitting is suspended until 2:30. Thank you. Thank you.